we decided to try and figure out if we could use participatory engagement methods to really break open the health map. My name is Jennifer Fraser. I'm part of a collective of early career researchers in the Department of Global Health and Social Medicine. And together, all of our research is really interested in exploring health and how it's spatialized from historical and ethnographic perspectives.
We're using 3 or 4 different methods of map making that really focus on our bodies in relation to the world, so kind of inner and outer health worlds, and how we might represent those or draw out kind of understandings or discussions of health through creative mapping.
So we've been integrating palmistry together with talking map method, where people can look back their life and their health. So we printed our palms on the paper, and then we were trying to find the lifeline, the health line, and we didn't interpret what these lines mean, but we went through individually and see how this health and environment around us has been affecting us.
Doing this as an artistic project gets away from sort of the very rigid, words that we use to describe these things. It allows you to talk about caring for health in a way that isn't just healthcare writ large. As one of the participants said, drawing a line can mean so many different things, whereas a word that sort of you'd have to put on paper to exemplify that line just can't tell you.